So today I am going to discuss the biggest myth about serum creatinine. I'm sure all of you would have heard the name serum creatinine, and I am going to discuss today as to why, if we take the creatinine alone, can be a misleading thing for most of us. I will just give you a hypothetical example of two patients walking into my care. Let's say there is first patient who happens to be a 25-year-old bodybuilder, and he comes with a serum creatinine report of 2.0 milligrams per deciliter. And a second patient who walks in thereafter is an 80-year-old frail woman. Her serum creatinine is 1 milligram per deciliter. And if I ask you as to who has got the worst kidney function, I'm sure most of you will immediately choose the bodybuilder to be having a worse kidney function. But here lies a catch or a surprise. The elderly woman may actually be having much more severe kidney disease and a worse kidney function in comparison to the young man. And how is that possible? So today I'm going to explain about the same, and also which happens to be the biggest misconception in the field of nephrology as to why serum creatinine alone can mislead you. So before we discuss that, let me tell you in brief about what is creatinine per se. Before we understand that what is wrong with the kidney which makes the creatinine rise up in the blood, let me tell you that contrary to the many people who believe that creatinine is produced by the kidneys, it is not so. It is actually produced by the breakdown of the muscle proteins, and it is produced by our muscles in the body. Thereafter it gets completely excreted out by the healthy kidneys. In case the kidneys happen to be diseased, there may be a retention of the urine giving rise to of the creatinine, giving rise to the elevated serum creatinine. So therefore the serum creatinine level will depend on two things. Firstly, how much does the creatinine being produced in the body, and how well the kidneys can remove it. So these two factors are important to consider together, not in isolation. And this is exactly the reason why the creatinine alone can sometimes be misleading. And it has been well said in our medical literature that serum creatinine concentration is influenced not by the glomerular filtration rate, that means the rate at which the kidney filters the waste products, but also by the build of the person in terms of muscle mass, the age of the person, the sex, whether male or female, the dietary components taken by the person, and there are a certain set of medications which can also interfere with the serum creatinine estimation. So in other words, to sum it up, the creatinine is not actually a direct measure of kidney function. It is only an indirect marker, as it depends on so many factors which I have just enumerated. So let's go back to our two patients to explain it further. Well, the first patient, as we discussed, was a 25-year-old professional bodybuilder or an athlete who has a very large muscle mass, and his creatinine values were 2.0 mg per deciliter. And because he has so much of muscle, naturally more creatinine will be produced, and even the healthy kidneys may not be able to excrete the entire creatinine which is present in the blood. Hence, even with a normal kidney function, the creatinine level may be high. On the other hand, the other patient happens to be a 80-year-old woman who has got a very little mass. She is frail, and her creatinine happens to be 1.0 milligrams per deciliter, and many labs will give this report as a label of normal creatinine. But actually, because she has less muscle mass, hence a very little creatinine will be produced, and even at a value of 1.0 there may be significant kidney damage or significantly impaired kidney function. So in other words, a normal creatinine is not a guarantee that your kidneys are absolutely healthy. So what else affects the creatinine? As we have discussed, there are several factors which can either increase or decrease the serum creatinine without any change in the kidney function. That means at the existing level of kidney function, the creatinine in the blood can be influenced by various factors, namely the age, muscle mass, sex, dehydration, lack of water in the body, and high non-veg or meat intake before testing in terms of red meat, poultry, and fish, etc. Then a bout of intense exercise prior to giving the sample. And there are certain medications which prevent the excretion of the creatinine by the kidneys. Just to give you two examples, one happens to be trimethoprim and the other one happens to be cimetidine. Then there is a condition which is pregnancy, which actually decreases the creatinine, liver disease, limb amputation, and that is why the creatinine is never interpreted by the nephrologist in isolation. They will always look into one of these factors which are there present in the patient. So I'm sure you have understood that there are so many factors on which the creatinine levels will depend. Firstly, whenever you go to a doctor, I'm sure you should be, instead of asking as to how much is my creatinine, you should be asking what is my estimated glomerular filtration rate, which will be there. Most of the laboratories are mentioning that. So even with a elevated creatinine, your estimated glomerular filtration rate may be within the normal range, and because this is adjusted for the age and sex of a patient, and it gives a better estimate of the kidney function. And second parameter of importance happens to be urine albumin to creatinine ratio, or in abbreviated form it is called as a UACR. So just remember that even before the serum creatinine rises, the protein leakage in the urine is the earliest sign of kidney damage. So even when the creatinine may still be normal. And the third is the trend of these abnormalities. One isolated creatinine value will tell us very little, but if it continues to rise, or if it continues to be remaining at the elevated level with the existing kidney function, then we have to evaluate it further, just to taking into account all these factors and to make out whether the patient's kidney functions are normal or not. So I hope you have been able to understand as to why the creatinine should not be taken in isolation to decide whether the patient is having a normal or an abnormal or impaired kidney function. So the take home message from today's session should be that whenever you repeat the report of your creatinine, you should ask doctor, what is my creatinine? And additionally, you should also ask, what is my EGFR? And is there any protein leakage in my urine? Are my kidney functions stable? And if everything is in affirmative, then what is causing this abnormality? I'm sure the nephrologist will be able to explain to you in a better manner and will resolve all your queries. So just remember that creatinine is just one part of the total abnormality which may happen and make the kidney function go impaired. So in the end, I will try to end my short talk today with a quote that you treat the patient and not the creatinine. That means don't treat the lab value is only a clue and is not a diagnosis. So thank you once again for watching, and I'm sure you would have found it to be of use. In case you've got any queries, you can always put in the comment section. Until then, we meet next. You share, subscribe, and keep discussing with your colleagues. And in case of any queries, you can always come up. So thank you once again.